So there are various ways that we address the digestive problems. One is dietary changes. That could be either restrictions and or additions to the diet to help the system work better. It may be supplements of herbs, vitamins, or natural substances. Acupuncture, anti-stress programs. Now, certain nutritional herbal products, as I mentioned before here, have been found to be helpful with certain digestive problems. For example, in a 2000 article in the Journal of Integrative Medicine, it's found that there are certain herbs and supplements which can assist the digestive system with restoring normal function. Aloe vera, licorice, ginger, and the herb peonae are thought to be effective in relieving gas and acid reflux, for example. Another 2000 article found nutrients useful in the relief of irritable bowel syndrome include things such as B complex, which is the vitamin B complex, omega-3 essential fatty acids, probiotics, which are the good bacteria. And again, there are a lot of different kinds of probiotic products out there, and not all of them are very strong. It may start out with a lot in it, but by the time it passes past the stomach, a lot of them can be killed off, or all of them, because certain strains are more resistant to hydrochloric acid or more resistant to the bile salts coming from the gallbladder. So you have to have a strain that actually will get down there to repopulate. There's also minerals such as selenium, zinc, magnesium, vitamin C, folic acid, bioflavonoids have been used to help with relief of irritable bowel syndrome. However, it's very important that before taking any herbal or nutritional supplement for digestion or any other health problem, you should consult a person trained in herbs and nutrition, because you could be getting too much of a particular thing, or the combination may not be the right balance. As mentioned previously, when I was specific about digestive problems, the use of tobacco products and the consumption of alcohol and caffeine have also been shown to aggravate digestive problems. So stopping smoking if you're a tobacco smoker is very important. Reducing alcohol issue. I mean, I don't know if anyone knows someone who drinks a lot of alcohol, but their digestive system is often really messed up because of it. Caffeine as well. Some people, if you drink too much coffee, you get this burning sensation. Caffeine also, some people drink caffeine or coffee in the morning to have a bowel movement, because it stimulates peristalsis. But that artificial stimulation is indicating that something, if you have to artificially stimulate it, something's not functioning properly in there. And so the coffee is just sort of a crutch. An overall natural approach to handling digestive problems would include improving circulation to all the organs involved, as well as reducing stress and taking the proper herbs and vitamins. Acupuncturists like myself are highly trained in relieving stress through proper nutrition, herbal medicine, and correcting the normal flow of blood and energy throughout the body. Often we get excellent results in treating patients with digestive problems for these reasons. We are required to complete a 4-year postgraduate degree, and our education is in various scientific studies as well, such as anatomy, biochemistry, microbiology, pathology, public health diagnosis, clinical disciplines, and health sciences, in addition to the study of acupuncture and herbs. In California, acupuncturists are licensed and tested for their licensure on both Chinese herbal formulas and acupuncture. So it's a dual license. In other states, it's just strictly acupuncture or herbs. As we mentioned before, acupuncture and Oriental medicine have been used in the Far East for more than 3,500 years and serves over 12 million Americans and 2 billion people worldwide. How many people are there in the world? About 7. I think we're going on 7, maybe 8 billion. So that's a huge number of people using it. And in this population, I think there were like a third who said that they have, so that fits. That's the same ratio. Various famous people also seek acupuncture care to prevent injuries and stay in top physical shape. Bill Cosby, Goldie Hawn, Sandra Bullock, Lily Tomlin, who are famous actors and actresses. And sports figures such as Carl Lewis, Charles Barkley, and John Lynch. Let's take a look at some of the people who have their digestive complaints help. For example, one person said acupuncture worked great for my acid reflux. I was skeptical at first, but I was so desperate for a cure for my anxiety and reflux that I researched it and finally tried it. After 2 visits a week for a few months, it also cured my tennis elbow and another old tennis injury that I had been suffering with. And this may be because of the inflammatory reducing properties that the treatment had. Tennis elbow is an inflammatory condition typically, but it's here in the elbow, not here in the stomach. Another person said, I was initially diagnosed with Crohn's disease 8 years ago. I was immediately put on prednisone and acetol. And this is typical because they're very strong anti-inflammatories. After being on these drugs for 4 months, I decided it was time to get off. I was not aware of what can happen when you stop treatment suddenly and had a huge flare-up. No appetite, abdominal pain, bleeding, etc. And these are the symptoms of Crohn's disease as well. After a week of this, I finally called a friend who had suggested acupuncture. She took me to her acupuncturist, and by that night I was able to eat again and begin the healing process. So that was a fairly quick response to the acupuncture for this acute flare-up. For 3 years I had suffered from diarrhea, stomach cramps, and back pains. I was unable to drive my car without taking medication. I consulted several doctors without relief. A friend suggested that I call her acupuncturist as he had had experience with treatments for this kind of pain. After 2.5 weeks of treatment, all my symptoms disappeared, as did the need for medication. I recommend acupuncture treatment to all suffering with pain. So how many of you would agree that there's nothing more important than being healthy and happy? Would you agree with that? I'd say so. So at this point, because my purpose is to help as many people as possible achieve maximal health and vitality so they can achieve their goals and purposes in life, as I mentioned, I'm required by the foundation to offer a free consultation to anyone who would like it, this lecture. And it will be a thorough review of your health history and a discussion of what's going on to see what you've done already to help with your issues and what might be possible that we might be able to help you with. And in some offices this can be as much as $250 or $350. I'm not charging anything for that.